Welcome to Beyond the Lab, a series by the Office of Career Development within the Biomedical Research, Education, and Training Department of the Vanderbilt University School of Medicine. My name is Kate Stewart. I'm here today with Ines Macias-Perez, who is in the Cancer Biology program. You're a grad student with them, with that department. Mm-hmm. So, welcome. Thank you for coming.
Thank you.
Tell me about what you did when you were here during your training.
Yes, so I was in the Department of Cancer Biology with Ambra Pozzi, who's also in the Division of Nephrology, and I worked on the prostaglandin E2, EP3 receptor and their variants in the role of colon tumorigenesis.
Okay. Mm-hmm. What do you do now?
So I left Vanderbilt and started clinical research with the Sarah Cannon Research Institute as a clinical research scientist. And there I learned about the life cycle of a clinical trial, all the regulatory bodies involved, how to manage, oversee, even develop clinical studies for oncology.
Okay, so but what's your current role?
So now I am principal scientist at Cumberland Pharmaceuticals.
Okay.
I oversee non-clinical programs, clinical programs with investigational agents. I also work now in rare diseases, which is a unique area compared to oncology. Mm-hmm. They have many more challenges and opportunities, so regulatory pathways that are unique.
Okay, so what does that mean? What do you do all day?
Oh, so my day is quite unpredictable. So I'll oversee sometimes regulatory documents that need to be written and submitted for investigational new drug applications to the FDA. Oftentimes I'm working in partnership with key opinion leaders throughout the country and the world sometimes that specialize in the rare diseases that we work in. Mm-hmm. We also have preclinical studies with labs, so I get to visit with researchers that use our compounds sometimes in preclinical models before we move them into clinical trials.
Okay. So if you took a pie graph of everything that you do all day, what would be sort of the categories of your pie slices?
So key communication. Communication. A lot of that. So everything that I learned, both written and oral communication, I definitely use. Critical thinking is especially important. And collaboration, capital C, yes, collaboration. We do a lot of collaborating with clinical investigators, researchers in the lab. So we couldn't do it without that team approach in clinical research.
Okay, so why is this role a good fit for you personally? Why is it a good match?
So I like the versatility. It's not just writing, because I do like to write, but I don't want to spend my whole day writing. A lot of it is collaborating with investigators and other industry partners. We also have contractors that we work with that have unique talents, and so it's kind of like just working with a big team, not just within our company, and it's an extension of our team. And so I just like, collaborating with individuals that are just as passionate about clinical research as I am. I like the flexibility. I like the fact that I could do this job from anywhere. It doesn't necessarily have to be done in office, although I don't mind, coming in and seeing, our internal team and working as every day working with them. So I think that's why I kind of stay in it. I was at a time working with radiosurgery, where it was an FDA cleared device that you were basically trying to do research to get approval from the medical community, but I went back to drug development because that's where I really think that I can make a difference.
Okay, so this is sort of a two-part question. Do you think if someone who is interested in your role would need a postdoc? And then furthermore, what are some of the skills that they need to pursue the role that you have?
Yeah, that's a good question. I don't think it's necessary. I think it doesn't hurt, because all that experience as a postdoc, you're going to be honing in on another separate topic and learning it in-depthly. You're going to be writing and presenting it orally. That's all polishing the skill set that you developed as a graduate student and just at a higher level. Mm-hmm. So I don't think that that'll hurt you, but I don't think it's necessary to move into clinical research.
Okay. And so what are some of the skills that they should obtain to be prepared for a job like yours?
I think communicating, written and verbal, is key. Learning how to collaborate with different just people and countries, different just different mindsets, because everybody has their background, their unique perspective in something. And so, sometimes we come in wanting to explain and do it one way, but we need to always be open as well to other. And so that's kind of a balance, and I've kind of learned that too, because as a scientist, you are very critical, and you think, you're working hard for a specific endpoint, and so you have to be mindful of everybody's goals and objectives, and then sometimes they overlap, sometimes they don't.
Yeah. So sounds like you do some networking. What are
Definitely.
some of your personal strategies to developing those professional relationships?
I keep contact. And I know that's very hard the deeper you go into your career, but I always try to contact the folks. If I'm having a meeting in DC, I'll let them know I'll be in town. But I always try to just, even with an email or a messenger, you just say, hi, how are things going? Let them know where I'm at, and let them know that the lines of communication are still open, and if there's anything I can do to help them in their career, I'm happy to do so. Yeah. And thankfully that strategy has worked, because a lot of folks that I've contacted in my career have contacted me back and said, hey, I see that you're working at Cumberland now. Is there anything, available in my area? And they'll send me their CV. Yeah. So it's kind of nice, to keep in touch. I know it's not always easy, as your family grows and your career opportunities and responsibilities continue to grow.
Mm-hmm. You've worked in Nashville, lived in Nashville most of your time since training.
Yes.
Talk about the job markets for PhDs in Nashville. What is sort of your thinking on what someone who wants to stay in Nashville would pursue or look for when they're looking for a job?
Yeah, that's another good question. I didn't plan on staying in Nashville, but I wanted to, and all the opportunities that presented themselves, I didn't seek them. They came to me, and I was fortunate to be able to stay. And a lot of the time, especially when you're starting clinical research, they involve a lot of travel. And I thankfully didn't have to do that. But oftentimes, if you want to get your foot in the door in clinical research, the first opportunity is in a kind of road warrior position, and you have to be open to that. I also think that if you want to stay in Nashville, sometimes in clinical research, you have to be open to new opportunities. I started in oncology, and I moved in 2 other positions that thankfully I was able to stay in oncology. But in this current position, it's in rare diseases. So you have to be, again, open to these new opportunities that present themselves, and they might surprise you, because I like the challenges that I've found in rare diseases. And they have actually made me more marketable, because they have, again, the unique challenges and regulatory pathways that not a lot of people get experience in.
Mm-hmm. If you had some words of wisdom for current trainees, graduate students, and postdocs, maybe that you would want them to know about or wish that you had known when you were a student, what would you tell them?
I would get involved in clinical research during my graduate studies. I didn't know about it early enough to maybe approach someone like a clinical investigator, or maybe even form my own dissertation around a clinical trial, like maybe a translational study. I would also, if you've already passed that step and maybe you're in a postdoc, get involved in some clinical research training, or volunteer maybe to be an intern and help with the operation aspects of a clinical trial, just shadowing, get an idea of what's involved in the life cycle of a clinical trial, so that you have an understanding before you jump into that career.
Great. Okay, talk about your work-life balance. How is that with the role that you're in? Talk about your balance.
Yeah, it's great. I've been very fortunate, again, to have balance. So I can do this job from home. I can do it traveling in the car, believe it or not. And so that's made it a lot easier to have a family. One of the reasons I didn't stay in academia was because I was worried about the hours, the nights, the weekends, the grant writing and so forth. And the work at the bench needs to be done at the bench. Clinical research, thankfully, can be done from anywhere, as long as you're not seeing patients and that aspect. But for what we do on the pharma side, we can do it from most anywhere. And so that's provided me a lot of balance.
Okay, good. Well, thank you for coming. We've loved having you.
Thank you.
Thanks.
I'm glad I was able to do this.